Botox part 2. Let's talk about it. So now that we've gone over what Botox is, some of you might be asking, what about the news lately with women getting botulism from Botox injections? What's that about? Yeah, I have that same question. But let's look at why that's happening and what to do about it. So the why. To understand the why, you need to understand what are the potential risks of using Botox. The risks are pretty well tolerated. They're usually pain at the injection site, some redness at the injection site, maybe a risk of infection, a small risk of infection at the injection site. Bleeding is also a potential complication or risk. And then if the Botox does migrate, you can get droopiness of other things like eyebrows, your eyelids. For that particular reason, I do have strict instructions for what to do after you are given Botox for my patients. There's also a potential risk to a baby, both in utero and one who is breastfeeding. And for that reason, it is highly recommended that you not seek Botox treatment either when you're pregnant or when you're breastfeeding. But for those who are getting botulism, what we're seeing, and I refer you now to the previous post on Botox and how it works, what we're seeing is a generalized weakness in muscles in the body. These muscles are the muscles we use to move, to talk, to make facial expressions, but also the muscles that we need to do very important things like breathe and swallow. This can be very life-threatening. The treatment for this is to use an antitoxin in the hospital and to get supportive treatment. So the treatment is basically go to the emergency room and get treated by physicians and nurses for the muscle weakness. Why is this happening? So there are two reasons why. One is that the Botox is not legitimate Botox, Xeomin or Dysport. These are counterfeit products that have been developed not by medical standards. And so when you have that, you can have variation in dosing that isn't normal for legitimate product. Also, people who are using this counterfeit Botox are people who are not licensed to actually use Botox, Xeomin, Dysport, what have you. And so they tend to over or underdose or just misdose or not use anatomy to correctly apply the product or be a little careless with where they're actually injecting the Botox. It's important to note that legitimate Botox, Xeomin, Dysport are only given to legitimate providers, meaning licensed providers. So how do you find a licensed provider? Well, a board-certified plastic surgeon or a board-certified dermatologist will both be licensed providers. And so that's an easy one. Having a med spa is not enough to say that the provider performing the Botox is a licensed provider. Beyond a plastic surgeon and dermatologist, there are other licensed providers who are equipped and trained to administer Botox. So how do we find these people? So to find them, one way to do it very easily is to actually go to the Botox, Dysport, or Xeomin website, and they themselves will provide a list of providers close to you who inject Botox and who are trained to do it. A word to the wise. If you find a spa, a med spa that's charging a really low rate for Botox, you have to be concerned that it's not real Botox. Botox, depending on where you live, typically goes from $9 to $12 a unit currently. If it's much lower than that, then be very concerned. But what do you think? Leave your comments and questions below. As always, love you lots, and bye for now.